Today we're here with licensed clinical psychologist, Dr. Massey. Welcome to Wellness Master Q&A, Dr. Massey.
Thank you so much for having me.
You're welcome. How's your day going?
It's going great. It's raining this morning, but we're going to be all right.
That's positivity. I like it. It's really good. I saw that you're in practice for 15 years in your own practice and have been a psychologist for 20. When you're as a psychologist, what do you specialize in the most and who do you see on a regular basis? I know in your bio you mentioned all different categories, but give our listeners a rundown of who you see.
Sure. As a clinical psychologist, most of the clients that I deal with are dealing with mental illnesses such as depression or anxiety disorders, trauma, abuse and neglect, or what I see primarily. And I would say my practice right now is pretty evenly divided between children, young adults, and adults, so that I'm seeing a large variety of age groups that are coming in, but most of the problems are in those higher clinical levels.
And definitely, do you see a lot of kids as well with all the things that are going on with the society and the pandemic going on? Is that affecting a lot of kids?
Actually, I do. Like I said, about 50% of the clients that I see would fall in that 18 and under. I started at age 5, and so I can see kids as young as 5 and some as old as, and they go about 18. And I'm seeing a lot in the teenage range. Our teenagers are really having a difficult time now and being able to deal with the things that they're presented with and the different challenges where they're still, it's a challenging time anyway in life as you're transitioning through those teenage years, but going through a lot that has been happening in the world has made it even more challenging for them. But I can say that I'm pleased that more of them are seeking help, so that they actually are coming into the office and talking about their problems and recognizing that that is a safe space for them to deal with the tough things that are challenging them.
That's good to know, because for parents listening out there, you definitely got to make sure your kids and teenagers, especially the teenagers, are being helped if they need that, because that can lead down to other issues down the road. As a mom, does being a psychologist help? Any reverse psychology there? Does anything to help them get to listen to you? I know having kids part.
I would definitely say being a psychologist helps me as a mom, because I'm able to, I think, have a better or just kind of a different appreciation for how they understand things or how they learn. And so I can make different decisions as a parent to make sure that I'm incorporating those things and using skills that really allow them to develop. And I would also say being able to help them have emotions be in the room. So many times we're not, and I'm a mother of boys. So oftentimes we're not teaching young men to be in touch with their emotional selves and how to use that effectively and not see that as a weakness or a problem. So I definitely feel that being a psychologist, it gives me a different appreciation for that. And I'm able to allow them to talk about frustrations or sadness or fears and really come up with ways to deal with that as opposed to just pretending it's not there.
Yeah, I know. Definitely when I talk to my parents, sometimes they give you that rough treatment. I'm like, oh, shake it off type of thing.
That's right.
It's good to know that you can understand what they're saying. That's very good to understand. That's very good that you can do that for them. As a professional in the mental health, do you see the most individuals are coming in more due to the pandemic, due to the fact that it's been such a tough year for people?
It has definitely been, I would say, and I've said this in a couple of spaces, that I have heard, the words mental health more in the last 9 months than I have in 15 years of private practice. So I'm excited that people are finally recognizing the value to mental health. And I'm saying, consistently that there is no health without mental health. We have to know what's going on in our psychological selves, and that, your brain is managing everything. So if we're not taking care of what's happening and how we think and how we feel, we're going to have those problems. So it has been definitely a rise in people coming in and saying, this is challenging for me. And really not just dealing with the pandemic, but saying that the downtime, the time to myself has allowed me to pay more attention to maybe things that people weren't paying attention to or staying busy to not have to deal with. So I'm definitely seeing an increase of people saying, I recognize I have some things I really need to deal with that I have not been dealing with effectively. And I've also got to do this new thing. And how do I make these adjustments? A lot of people struggling with the isolation of being at home and having to deal with everything is now in the same place, my work, my play, and how to really navigate those spaces. So it's been important to have the clinical environment where people can come in and really build up some skill sets to deal with these unprecedented situations.
And that's good to know, because I know, for one, a lot of people that I talk to have tried new hobbies to get their mind off of the pandemic and everything else going on around them. I, for one, did the same thing. I've been doing a lot online. And I'm speaking about online. Do you focus a lot of your work online, or is that in person, or both?
It has been both. Early in the as we started with the pandemic and we were really on shutdowns, I was able to switch to telehealth pretty seamlessly, so that was good. And now that we have a few more freedoms around that, I'm doing 2 days in the office and the other days telehealth, and that's really been a good avenue. And even for additional people seeking help that may have not done it before, the telehealth environments has been really a positive avenue for people, so I can take a moment and sign in and do that in ways that they didn't feel they had the freedom to do before. So I had always felt, and I still do prefer the in-person environment, but I'm recognizing the benefits of having telehealth available. So I plan to keep it as a part of what I offer going forward, because it seems that it's been able to create an avenue for many more people to seek and stay consistent with their mental health care.
And you could reach more people now. Instead of Memphis, you could go outside of Memphis. You could
That's
do both
right.
Memphis, and you go all over Tennessee or wherever you're licensed, which is the whole United States, I'm assuming.
Yes. Mm-hmm. As long as I'm here in Tennessee practicing, my Tennessee license covers me.
That's perfect. You can't go wrong with that. So you expanded your business, which is
That's right. That's right.
The big question our listeners are looking for: what is anxiety, and what chemically in the body is happening when someone has is going through anxiety, and what types of anxiety are there? And give us like a brief, maybe rundown of the different types of anxiety that exist.
I'm really glad that you asked it that way, because anxiety really is a complex thing, and we tend to think about it in kind of catch-all space. So I'm glad that even your question suggested we got to understand, there's some different levels to this. So I definitely hear a lot of people will talk about, probably the most common thing that people talk about in terms of anxiety is stress, right? So they refer to being stressed, and stress is really a form of anxiety that we may be experiencing in relative to that. So you have your stress anxiety, you have fear. When people will talk about they're anxious, and when we break that down, we're able to identify this is a fear-based thing. We got to understand what's happening relative to fear and how we're going to deal with that. You have trauma anxiety, where people have experienced a certain trauma, and so certain things in their world or in their mental memories and things like that are manifestations of that anxiety that comes from having experienced a trauma. We can have social anxieties, where people have difficulty in certain social environments and those types of things. So anxiety is very, very complex in terms of those things that someone may be experiencing, and even to the place where they may experience a panic attack. And so when you talked about kind of what happens in the body, there can be a lot of different things that are happening in the body. But basically, when you think about that from the biological standpoint, is that we know that our bodies are wired to deal with certain situations to protect self. We are biologically wired to preserve our own life. So most of the time, what's happening in our anxiety situation is what you've heard people refer to as our fight or flight is activated. Something says there's a threat to you, so either you need to fight that thing off or you need to flee to preserve life. So what's happening is it's our normal system is kicking in, and oftentimes either it kicks in too often, or it kicks in too intensely, or it kicks in the wrong place. And that's when we're looking at more anxiety is creating a problem and not just being a part of our regular response to take care of self. So part of what I would want to do clinically is understand what's happening. Where is that breaking down in terms of what should be our body's natural wiring to take care of ourselves, and then that not happen in the most effective way, so that we can deal with that. And those are very real things. Sometimes people will say, well, anxiety, it's just in your head, and you just need to get over it again, or just shake it off. And it's much more problematic than that. And when someone is really concerned about what's going on with them, and then our brains generalize, right? So we learn something, then our brain catalogs that, and then when we see something similar to that again, it tells us that that's what that is. We are much more prone to think about that in a positive way. For example, I learned that, okay, this animal with wings and feathers is a bird and it flies. Got it. So every time I see something like that, my brain tells me that that's a bird. And we're good with that. What we don't realize is that our brain can do that in the negative way too. So let's say that I was in a car accident. And so now when you get into that big thing with wheels and get on the expressway, you have accidents. So if my brain could do that, and it's creating that connection, which we don't want the brain to do, but it will do that just as it decided everything that has wings and feathers is a bird. So we want to make sure that we are mindful that this isn't just some wacky processing that's happening when we're developing anxiety. It's our brain doing what it always does. But sometimes we have to interrupt those things and create new pathways that don't allow us to be responding inappropriately to what the brain is doing.
Very similar to PTSD, or people that don't want to leave their house is another type of anxiety where you're extremely afraid of leaving your house because you're afraid of getting ill or sick, especially nowadays.
Especially now.
OCD, I've dealt with washing my hands, and now even more. It's like 1,000 times a day. And like literally I have to keep telling myself, okay, my hands are dried out. I got to stop washing them, try to figure out a way to, and a lot of people are dealing with that, is OCD, PTSD. For people out there dealing with those types of anxieties, what's the first step for them? Is to contact a psychologist, do you think, or maybe just internally try to self-talk and help themselves with some self-talk methods?
I think probably my bias is going to show here that I would definitely say to see a psychologist or, a clinical, because you want to understand that, particularly when you talk about those things like, OCD and PTSD, these are real illnesses. Mm-hmm. And sometimes you don't have the skill set to just do it on your own. You don't know what it is you need to be changing. So yes, I want you to use positive self-talk, but you will likely need it to have met with a professional who can help you understand what messages do you need to be sending yourself, because some people will try to talk to themselves and say, well, just stop it or don't do that. Or, that doesn't make any sense. And it's not the rational talk that will get you to change the behavior, right? Because there's something else happening in your psyche that is countering the rational. And you may be able to tell yourself, like in OCD situations, when people it's a compulsion, right? That I just feel compelled to watch one more time, or to check and make sure the doors are locked, or rinse that thing off one more time to make it clean. And so logically you could say, it's okay, you don't have to do that again. But then you still feel like, let me just do it one more time. And so you aren't able to just kind of talk yourself out of it. And there may be other things that we do. For example, it may not be talk yourself out of doing it. It may be, okay, try to give yourself a limit. When we start there, say you're going to watch 5 times and try to stick to the 5. And then we maybe try to bring that down to 3, so that there are different ways that you may be able to challenge those things by working with a professional that understands the nuances that you may not be able to develop on your own.
And this is kind of funny, but compulsive shopping on Amazon due to the pandemic. They sit there with their credit card all day long.
Yes, retail therapy. Yes, I'm telling you, dangerous. So we got to be out here making sure we're connecting, and don't give in to that retail therapy. Don't do it.
I see a lot of people doing that. I hear a lot of people talking about it. Now, from an anxiety standpoint, if a person's feeling an anxiety attack, what would be the signs of a person starting to have an anxiety attack? I know everyone's different, especially social anxiety, or a person starting to get jittery, or how does that feel? Or is it the blood pressure, heart rate changes? Like, everyone's different, but what is the main signs of an anxiety feeling if they don't think they have anxiety? For years, I didn't know I had anxiety, but then I found out, I'm like, whoa, that's anxiety. Pain in my middle of my back for 20 years burning. It went away once I was able to figure out it was anxiety. I thought it was a back injury. It was never a back injury. I went to chiropractic, massage, never went away. It was a burning sensation in my lower subscapularis, right below my scapula. And that was just from tension, anxiety, and some people get in their neck. The reason why I say that is a lot of people dealing with that. Just curious to see what your thoughts are.
So it definitely, because the experience of anxiety, and then in those physiological representations of it, can go all the way from, like you said, the pains and those things, to full-blown panic attack, which is a much more of a physiological response to the anxiety. So we can have those physical symptoms where people are having from nausea to headaches, like you said, certain pains, especially when we can't find those medical answers to it, that we may be experiencing some anxiety in that space. People deal with things that you may look at as regular fear responses. If I have sweaty palms or a racing heart, some people have racing thoughts where they get really anxious, and they can come up with all the what ifs and 1,000 scenarios of how this is going to go terribly wrong, and get worked up about those things. So it can show up in a lot of those different ways. And then we start getting some of those things to connect to one another, and you can have real problems. A lot of young people that I'm seeing, I'm recognizing, have a lot of like test taking anxiety, and they're finding out that they get really worked up prior to taking tests. So what they do is try to study more. And really focus on that. And that's not the problem at all. It's the anxiousness that gets them distracted and able to focus. And so they can't access all this content that they really do have. I did that with a young lady who was in a teacher's program, and she couldn't pass her praxis exams. And then when she mentioned to me the anxiety she was having, I was like, that's our problem. You didn't tell me that before. Let's do this, this, and this. And within 2 weeks, she had passed the test because she learned to better manage the anxiety that was going on. So it definitely can come up physically. And that's one of our main errors, is that we tend to focus on medical explanations for our body responses, our physiological responses. And so it's very important that we're starting to learn more that your mental distress, your psychological distress can very much show up physically. And if we're not at minimum asking the question about people's mental state or about their emotional selves when they're experiencing something, we're missing that. So I am seeing it a lot more where doctors are reminding themselves to ask the mental health questions, or we're seeing more partnering of mental health professionals and medical professionals in the same practice, so that we are looking more at those connective ways that these things influence each other, instead of keeping them in their own silos, as if we don't know they're happening and communicating within the same body.
And depression and anxiety can kind of go together. Is that correct? In a way, like depression can cause anxiety, or anxiety cause like depression because you're feeling one way and others affected.
Very true, very true. That we often see them showing up together, and they can feed each other in those ways. As example, we were using the trauma example. If someone is having a trauma experience, or had a trauma experience, and then they start separating from certain things, like I don't go outside anymore, I don't go to that place anymore, I'm not around people, and so they may start to miss some things that were very important to their lives, or they're getting negative feedback from other people about their absence and not being around, and so that can start to have them feel bad, because now I'm frustrating my friends, or I'm not pursuing my career and I lost that job, and so now that can trigger some depressive feelings, and whether that goes into a full-blown clinical disorder as well. So it really speaks to the essential part of being able to know what's going on with you mentally, because it undergirds everything, and so many things that we work hard for or desire can go astray if we're not managing our emotional distress.
Are there a few tips that you would recommend someone start with and then see the psychologist? Is there a few tips they can do if they're really experiencing anxiety? Just to really that feeling of the social anxiety or test-taking anxiety or anything like that?
I think definitely step one is acknowledge it, that this may be, allow yourself to consider, what is this? What am I really feeling? How am I feeling about this? So when we start there, it gets people identifying there may be something happening with my anxiety. Journaling is a good way to help people get in touch with what they're thinking and feeling, because you may not be open to talking to someone else just yet, but if you can at least do your own stream of thought, writing some things down and trying to be honest with myself about what am I feeling, kind of what's going on there. So we want to make sure that we have an avenue for that. With a lot of my young people, I have recommended like video journaling and things like that, if they don't feel like writing it out and there's just one more assignment or something like that. A lot of people have been able to take to just being able to kind of dictate a journal and just talk it out. And so you can film yourself or record yourself. And that's another way to do that without having to write it down. Rest is a good thing. When you recognize you're getting worked up and I get overwhelmed and I don't want to do these things, you want to make sure you're giving yourself a break so that it's okay to take a break and plan that. So I like to encourage people to take breaks, and also setting particular tasks in that same time. So I may say, I'm going to take a break, and then at 2:00, I'm going to do these 2 things, so that you really just try to give yourself one little bit of thing to manage at a time instead of the whole large task or the whole large thing. So let's say I'm having trouble going out of the house and I don't like to do that yet. And I'm really getting nervous about what's safe and what's not. So what I'm going to do today is drive to the gas station. So I'm not going to get out and talk to anybody, or maybe through the car wash so that I don't have to touch anything, but I am out and I'm moving. And so I went out and I went through the car wash and I came on back home, and okay, that was okay. Maybe tomorrow I'll try the grocery store at 6 a.m. because there are fewer people in there. So just really being able to think about how do we ease our way into things, and not feeling like we've got to tackle every, like all or nothing kind of space. So those are some different things that we can do. Deep breathing always helps. I know people feel like that's kind of cliche, but what it does is it allows you to focus on something you can control. I can control the frequency and the speed of the breathing. And so it's not that changes the anxiety directly. What it does is changes your focus and allows you to not be focused on the thing that is disturbing you, and then trying to regulate your body's response to what it's experiencing. So you can do that deep breathing. And the last one I would say is what we refer to as grounding, being able to get yourself focused on what's happening in the right now. Because a lot of our anxiety often comes from anticipation, where we are worrying it's going to happen, or reflection. We're going back and we are ruminating, going over things that have happened in the past or things that have bothered us. So we try to get you to focus on what's happening in the here and now. So you want to use some grounding techniques, and that one of the easiest ways to do that is think about the 5 senses. So you think about 5 things that I can see, and that allows me to be very focused on what's happening before me right now. 4 things that I can hear, 3 things that I can smell, or 2 things, so that you're able to just kind of go through the 5 senses and allow yourself to really focus on the here and now. And again, it's not taking away the thing that makes you anxious, it's getting you to control the body's response to the experience of anxiety.
Those are some excellent tips. I know for one, I had COVID and I still can't smell or taste very well. So that makes me anxious, but I'm able to cope with it. I'm positive. I'm happy that I have just that issue going on. Other people are dealing with a lot more. So for me, it's like, hey, things are okay, things will adjust. And for me, it's just talking to myself and telling me, hey, take a deep breath, like you were saying. That's perfect. Those tips were very, very good. And I hope everybody listening out there tries those tips. Right after the break, we're going to hear more about anxiety and also how to cope with a panic attack. We'll be right back from a short word from our sponsor. We're back here with clinical licensed psychologist, Dr. Massey. Before the break, we talked about anxiety, but let's talk a little bit more about anxiety. Right now, with social anxiety and performance anxiety, we touched a little bit on. Do you feel if someone had stage fright, are those same tips useful for stage fright, someone performing like a musician or an actor or a kid trying to do his first speech in front of class?
Very much so. And I like that you identify those performance anxiety spaces, because what we want to remember is we can experience anxiety in places that aren't problematic, for lack of a better word. It's not at the level that it keeps you from functioning every time you experience it. Some of that that happens when we experience anxiety is what we want to happen, right? When we talk about if I need to be performing my best in a race, then my body has to get geared up to do that. And so our normal biological response does that as well, that I'm going to get that peak performance because I'm going to get up and I'm going to have that high level, and that gets my endorphins going and those other things that happen biologically. So we want that to happen. What we don't want it to do is to be exaggerated, and then we can't do what we need to do. So we wanted to understand that the process that happened is a normal process, and we want to keep it in that regular box is what I call it. Keep it in the regular box so it doesn't get overwhelming. So we want to make sure that when you recognize I'm keyed up, and then what do I do so that I can deal with that? For example, my youngest son, he's 10 and he was competing in a swim meet, and I could tell that he was keyed up. He's like running around and he's breathing fast, and he's like, oh, and I was like, okay, wait a minute, slow down. And he said himself, I just can't. Sometimes I can't control. And I was like, okay, so let's breathe. Let's talk about what you're going to do, which race is next. And so I really had to slow him down, let him think about his skills. And I said, so I don't want you to think about trying to go as fast as you can. I want you to think about swimming your best technique. So we're swimming which race next? What are you going to focus on? So if it's his kick or his stroke, so that he could really calm it down. So that self-talk was there, that I could say, okay, you got to slow down. And so breathe. So then I'm teaching him to breathe slower. And then his next race was a lot better than that, that first one when he was so hyped up. But that is exactly what we need to be, that those skills can help you be able to make sure that I'm managing, my performance keyed up, because I want it to be there, but it can't be so overwhelming that I don't perform well. So all of those strategies can definitely be in place when you're trying to manage just the things that I want to do, and do them well.
A lot of people say they go blank on stage. That's a big example of that. Going blank is a performer not doing well, or like an athlete messing up because they're so hyped up and burned all their energy. And that's something I have to work on too. I have a lot of things to work on. That's why I'm doing these interviews, to learn from the professionals. I really want to
exactly learn. And that you're creating this forum, because a lot of people do experience the same things and they don't talk about it. They don't know where to talk about it or where to get the information. So this is amazing that you're creating this platform and asking these tough questions that a lot of people don't ask out loud.
Yeah, I want to be like the anchors on TV, the news anchors, like figuring out why people deal with these situations, because I feel like everyone should be able to talk about it. And it's great because it helps me actually feel great. Like I wake up in the morning excited to hear from new people about information and learning.
Yes. There definitely have been some great guests on this podcast. So get people, we got to continue to tell them to log in and check it out.
I feel like I'm one of those guys that travel around the world looking at the new foods and new different technology and history. I'm doing a virtual version of that.
That's right. We got to do that. And then we can pitch it to CNN. Let's make this happen.
Now, a big question for our listeners out there with panic attack. Is panic attack the same as an anxiety attack? And what are the symptoms of both, and how does that feel? Because I know multiple people have experienced it and been hospitalized for it.
Mm-hmm. Yeah, it's I think in the common way of life, just kind of in regular everyday life, people use the terms interchangeably. And I think probably more so on the clinical side, we would be looking at a panic attack as a very particular anxiety experience that is high in the physiological component. Because people may say I had an anxiety attack, and they're really more talking about I was really anxious before that thing happened or when that was going on. And it's not necessarily the same as what would be clinically identified as a panic attack, which you just explained can be so severe that a person may end up, in the hospital for that. So when you think about panic attack, it's the severer end, the more severe end of what your physiological response is to anxiety. And what catches people often is it can mirror heart attack.
Mm-hmm.
Some of that scares people. So you have this physiological response that feels like, my heart is racing, or there's a pain in my chest, or I can't catch my breath, the hyperventilating, the sweating, feeling faint. So all of that happens, and people can get more anxious because they're like, oh my goodness, what is happening to me? And then that spikes the anxiety instead of bringing it down. Mm-hmm. It's even more of those responses happening. And so when all of that is happening physically, our first thought is this is medical, and I've got to get to a hospital and get this checked out. And so you end up, in an ER, and they're running all the tests, and they're trying to rule out everything, which is what they're going to do. And oftentimes you get to, if they cannot identify any medical problems and they're looking at all those symptoms, they can say, because we are certain this is not your heart, this is anxiety, and this is a panic attack. And we've got to be able to do that. And then, so our work becomes being able to help people to, once you know that you have possibly an anxiety disorder or experiencing that we get better at determining that. Is this something medical that I go to the ER for? Is this my mental health or my mental illness, and I need to deal with some particular strategies that my therapist or my psychiatrist is working on with me to deal with it in that way, so that people are a lot more geared toward that. And I would also say this, the better we get at not letting the mental illness or mental situation be a lesser problem, the medical people will say, well, oh, it's just a panic attack, or it's just, it's all in your head. And people say, well, it's not all, so what I say to that, well, it's in your head because it's a mental problem, not because it's false. Right. So being a mental problem or being, all in your head, it's not that it's not a real thing and you are imagining it. What it means is it's not a biological medical problem. It's your psychological problem. And we've got to know how to deal with that just as we know how to deal with what is going on with us medically. And so I've been able to work with some clients that experience panic attacks and having to make that distinction so that they're not constantly in the ER and being frustrated because they're not finding anything and getting more and more anxious because they are feeling that there's a medical problem being missed. And so that spikes the anxiety even more because you don't want to risk, I could be, on the verge of losing my life. We already talked about preservation of life is how we're biologically wired. So if I'm worried that this is happening to me and the doctors aren't finding what's wrong and this is really going to take me out one day, what that does is keeps the anxiety high.
Exactly.
And the person experiencing the panic attacks maybe even more intense or more frequently and constantly frustrated by not being able to find anything. Well, what if we as a society, one, we're keyed into asking the mental health questions just as directly and felt just as confident that if I'm experiencing that, I know which treatment professionals to go to and how to deal with it. And it's not a lesser problem, it's a different problem.
And it's great to talk about it and experience and talking about it lessens the anxiety, and people know what's happening internally and physiologically and also psychologically at the same time. It almost takes away the anxiety. For me, it almost took it away instantaneously when I knew. I was like, I'm dealing with anxiety. I'm dealing with trying to cope. Because when I had a panic attack, I'll share this, is that I went completely numb from head to toe and couldn't feel anything. Chest racing, heart racing, blood pressure up. And I did go to the hospital. And it made me more frustrated when the doctor said to me, we don't know what's happening, because I had just got off of COVID, that thinking it was COVID symptoms. It wasn't. It was anxiety meshed with post-COVID. And the reason why I shared that, a lot of people out there are dealing with post-COVID and anxiety. If you can get the anxiety under control, then you can know what the real symptoms are of what's post-COVID or not post-COVID. And that anxiety is meshing together. And that's why this situation with all the things happening in society is causing a lot more of that to happen. But listening to this podcast today, I hope people realize that it can help them and it can bring down those feelings of anxiety and contact
very
you
much
as
so.
well.
And I think that's what we're trying, helping people to hear is that even when we have medical conditions, the anxiety that we experience relative to that can really exacerbate the symptoms that you experience or create new ones that are physiologically there, or slow your healing or recovery processes because of what's happening on the psychological side. So when we are better able to recognize these systems really do inform each other, within us, and how do we make sure we're addressing all of them, as I was even giving the examples and as you were, is that we can have anxiety and then we have anxiety about the anxiety. And what that means is the anxiety is going up, not coming down. So when you're able to say, I'm having anxiety, and then I don't get anxiety about the anxiety, we can deal with that differently. I remember working with a young woman who would have panic attacks, and she was like, and I'll call my mom, and then I'll stay where I am, and then she'll come and get me, and she'll drive my car. And I was like, whoa. This is keeping your anxiety a whole lot higher. What we want to do now that we know it's anxiety and it's a panic attack, we don't need to have a crisis response to a panic attack. Mm-hmm. So when you're experiencing the panic attack, we can call mom to talk me through it, to help me do my deep breathing or get me to use my grounding techniques, not come and rescue me and pick me up and leave my car and I can't function. Because what I want to help her develop is the skills to understand that's what it is. Let's learn how to manage it and not be anxious about it being present, so we can manage the anxiety of the other things around that. What was there a trigger? How do we understand our triggers and work through that, and not feel this is a crisis and we've got to involve everybody and do those things, and maybe even continuing to perpetuate that anxiety experience. So I definitely agree with you that when we learn to manage what's happening with ourselves psychologically, we can live in a lot more comfort and a lot better quality of life.
And that's perfect examples and explanation. I really appreciate that. The biggest question is your total wellness and your wellness journey. What do you do to keep yourself healthy? Because you deal with a lot of different people and different mental states. What do you do physically for yourself to help you and your coping mechanisms just to keep yourself feeling well?
Okay, yeah, very, very good question. Because and this is going to sound odd, but one of the things that really helps me to bring it down a little bit is as I like big puzzle games, like a Sudoku or something like that, because I'm a thinker. And so it really often doesn't work for me to just try to veg out and be like, I'm not going to think about anything and just enjoy the sunshine. I struggle with that. So it's better for me to say, let me, play this game, and so it challenges me mentally, but not keep me focused on things that stress me out. So if I'm doing Sudoku and all I got to worry about is where does this 9 go, it's a lot more relaxing than everything else that's going on. Secondly, I would say family stuff. I really do enjoy being a boy mom, and lots of stuff that we get to do together. So a lot of my relaxation is getting involved with them and whatever they have, going on. So I have definitely told people that they don't understand my definition of a day by the pool. I laid back in the lounge chair, soaking in the sun. I'm pulling out goggles and checking times and calming down, hyped up swimmers. That's my day by the pool. So those things are always enjoyable. So family time is good, spending some time with the husband as well and being able to do that. And I'm a quiet time kind of person. I like a little me time. So if I can settle everything down in the house and make sure I save a few hours or a few minutes, I would say, to some me time, if that is playing the game or reading or something. So it's very important for me to have that separation to do that, just quiet time and making sure I get that in. I'm not as good as that as I need to be, but it's definitely important. Nor the workouts. They're good when I get them in and I love it. I'm just bad at making sure I make time for that physical exertion and what that kind of brings to me to do that too. So I'm trying to get better and making sure I get my workouts in more consistently.
Understand, definitely. I have to be my own coach. I have to have a little coach on my shoulder tapping me. Hey Jay, go work out. Yeah. So, and the question that I always ask everyone, what is your definition of total wellness?
That is a great question. I like that. So for me, what you heard me talk about in those different ways was, so for me, I would say it's mind, body, soul, right? And that we recognize these things are connected and that we want to be able to take care of ourselves in all of those spaces, because to neglect one is to influence all. So I want to make sure that I am paying attention to what's going on with me mentally and psychologically, that I'm allowing my feelings in the room, that I can say when I'm frustrated, or say when I'm sad, say when I'm afraid, because too many times we're not allowing ourselves to be honest, particularly about negative emotions. People are great with the positive ones, where I can be happy and excited and all that, but we often find ourselves trying to push away the negative ones instead of making sure that we can understand them and deal with them and have that presence. So I want to be able to do that. And then physically, I want to make sure that I'm taking care of, how I eat, or am I exercising, or am I aware of any changes, and taking care of visiting my doctors and things like that on the healthcare side, and that's taking care of my body. I'll never forget being on a panel with the physical doctor as I talked about the mental health, and she talked about the body side, and she just said, this is the only place that you have to live, so you've got to take care of your body. It's the only place. And I was like, wow, that was good. So I want to make sure, so I'm telling you, your mind, it runs everything. You got to take care of your mind. It's going to handle everything else. You got to take care of your body. It's the only place that you have to live. And then your soul is just those seeds that feed you. Right? We want to make sure that we are taking care of those things that really do contribute to our joy, because it doesn't happen. We have to be the authors of our own happiness. So I want to know what makes me feel good in that soul space. If that's my spiritual connection, if you have, your spiritual functioning, or if that's my civic work and I'm going out and doing some volunteerism and making sure I'm looking out for the charity of others, so that if we are able to keep those things in play, then we can have a total wellness.
That's a great definition. And for most people out there, they definitely have to encompass all those aspects. I really appreciate your time today and your expertise. How do we find you, and where online can we find you to get a hold of your services, or to learn more about you, or to have you speak at an event or online?
Oh, perfect. Thank you for that. I do have a website. You can find me at drlpmassey.com. And it has a space there for reaching me on the clinical side, or for reaching me on the mental health advocacy side, if I can come out and share some information and in a speaking space. So that's the best place to go and look for me. And it's the same thing on Twitter or Instagram. It'd still be the DRLP Massey, and you can find me that way.
Very good. I hope all our listeners reach out to the Dr. Massey and her knowledge and her expertise. I greatly appreciate your time here on Wellness Master Q&A. I learned a lot. I know other people have as well. But I hope you have a great day, and thank you so much.
Thank you so much for having me and for creating a platform for us to talk about mental health.
You're very welcome. Have a great one.
Thank you.